Thank you. Thank you so much, Dr. Bim. I appreciate your wonderful introduction. Doctor to be, actually. I'm not quite doctor yet, but Doctor to be. But thank you again just for this opportunity. Thank you for this platform. This is my passion. This is what I enjoy doing, talking to people, engaging with people, just allowing them to know more about the nursing profession and the health professions as well. And really, my goal is to give nurses the tools that they need in order to function in a highly competitive healthcare landscape. Because a lot of times we don't see beyond what we do on a day-to-day basis. And it's important that we are thinking on a global context, in a global context about how our presentation, how our professionalism, how the way that we present to others affects our entire profession. And so that's the reason why I wanted to talk about this topic today, because it is near and dear to my heart. And in fact, I had been preparing this presentation for no specific audience when Dr. Akintadi brought this proposal my way. And I thought, wait, I have something that I was already working on months ago, like for no reason. I was just putting it together because it was on my heart to do. So again, that shows you the impact of preparation and following through with, the promptings and the leadings that you get in your spirit. So that being said, let's get into our topic for today. I hope this group likes to talk and chat because we're going to be doing a whole lot of interaction, and I want people to, really talk to me and interact and share in the comment sections. I love all of that. So please let's do that. That'll be great. Okay. So a little bit about myself. Okay, there you go. So again, my name is Chinelo. I am founder of Nurse on Purpose. My goal is to elevate the perception, media portrayals of nursing. And like Dr. Akintadi said, I am a board certified family and pediatric nurse practitioner. I have 15 years of experience plus in nursing. And again, I'm passionate about elevating media portrayals about nursing so that people truly know who nurses are and what we do beyond just the stereotypical images that we see in media. And so to this end, I started to create content to show about said passion and to talk about it. And last year, I started a podcast called the Nurse on Purpose podcast. Um, and in this podcast, I interview guests that are, of course, nurses who are in different areas and arenas in nursing. Very, very interesting roles. I've interviewed Dr. Akintade, who's a dean, talked about his story, really just going through the processes by which people became nurses and also what they're doing now. It's my own way to showcase nurses in their true color and in their true light. Sometimes we watch TV and we see all kinds of weird images of nurses who are rude and nurses who are mean, or nurses who are nonchalant, and nurses who just hold a clipboard and follow the doctor around. And I really wanted to debunk those myths by saying, hey, let me present to you real life nurses. This is what we look like. We are male, we are female, we are of all colors, we are of all backgrounds. We have all kinds of, even in political arenas, we are in research, we're in leadership, we are in space medicine, and I have met some incredible people by way of this podcast. And so I'm incredibly grateful for this journey so far. It's a very new podcast, I would say, but I think that it has been one of the highlights of my career thus far. So very grateful for that. Okay, now let's talk professionalism, guys. When you think about the word professionalism, If you want to just write in the chat, what comes to mind? What are some images that you think about? And this is where I'm going to need some interaction, right? I want you guys to talk back to me and want to hear what everyone is thinking. I don't see very many people's pictures or videos up. So if you want to open up your video, please feel free. No shame, just where this is a community of friends. Tell me what you think when you hear the word professionalism. And also, you can talk. You don't have to type. If you want to talk, you can do that. Professionalism. So, um, as you guys are doing that, I will share certain things, certain images with you, right? So when you think of the word professionalism, you might be looking at an image like this, or somebody like this who is dressed in a business attire, who works in a large corporation, 9 to 5, maybe holding a specific office in industry, maybe a politician or a lawyer. But I want to present a bigger picture to you, that professionalism does not only begin when you've settled into your career alone. It is not only meant for a select few. It begins way before you enter into the workforce, and it encompasses elements beyond just where you work. Anyone in any area, as long as you are an adult, can have a professional outlook to their work and their lives. So look at these images, for instance, right? The first picture is a nursing student. The second picture is of a janitor, a janitorial company. The third is of a street hawker, right? So even people at any stage of your life, whether you're a blue collar worker, whether you are a student, whether you are a healthcare worker in scrubs, professionalism is for everyone. It applies to everyone, right? So I don't know if I got any responses yet, but let's talk. What exactly is professionalism? And now this is the definition that I am going to use. Professionalism is the set of behaviors, goals, and qualities that characterize a person within a professional environment. I termed it as both an art and a science because it's not only about what you do, it's not only about the job that you do, but it's also about how you do it. So the what becomes the science and the how becomes the art. When you combine both of these components together, that's when you achieve true excellence in professionalism. So that's the way that I define professionalism, as both an art and a science. I know some of us have seen TV shows where maybe the physician or the nurse, let's use physician because that is more kind of relevant in terms of what we see on screen in professionalism. They might be brilliant, like for instance, Dr. House, if you guys know the show House, he was a brilliant physician, great guy. He knew his stuff. He would catch a lot of errors, and people wanted them to take care of him to take care of them, I'm sorry. But he had zero bedside manner, right? He was rude, he was uncouth, he was arrogant, he was everything that you could think of terrible. However, he was still brilliant. Now, he had mastered the science, but the art not so much, right? So when people need care and compassion, they might not go toward him. They don't want his care, right? And so when you're treating a patient, when you're taking care of your community, you need both heart, soul, and mind. You cannot neglect one for the other. And professionalism does not end just with your degree or with your knowledge base, okay? So that's the term professionalism in a general sense. But let's talk about in healthcare, right? Um, in healthcare, it can be both an art and a science. And like I said before, the science encompasses your competence, your clinical excellence, your objective evidence-based standards of practice. This is what you're taught in school. This is the things that mentally. However, the art becomes the intangible, subjective, and humanistic side of care. Remember, we're talking about healthcare now. We're not in a boardroom. We're not in a courthouse. We're talking about human life here. So care and professionalism has to bear a humanistic component to it. Otherwise, it's incomplete. It cannot be complete without the humanistic part. And I think I did get some chat, but I didn't. I don't realize that. Okay, let me see if I can. Sorry, there's just a lot going on here and I wasn't sure. Oh, there it is. Oh, perfect. Okay. Hold on, let me read my messages. Okay, so specific attire, that's perfect. Let's open this up real good. Well, professionalism also has to do with knowing how to use your Zoom chat box. Okay, Dr. Bridge. Right. Dr. Moore, you said using specific speech. That's correct. So not using medical jargon, correct? Talking directly and clearly, correct? And specific attire, perfect. How you dress, how you present yourself. Dr. Akintade says duty, discipline, and accountability. That is perfect, right? The ethics, what we owe our patients, what we owe the community. And I'm going to talk in both terms because I know that nurses nurse not just patients in a hospital setting, but we nurse the community. And of course, discipline and being accountable, that's perfect. So all of those things. Princess, you said communication. Well, that's like number one on our list, right? How you talk to people matters a lot. Okay, so I'm going to close this chat and hopefully when another chat comes, I'll be able to see it. Otherwise, just like shout at me because I definitely want to interact with you. All right, so again, reading off my slide, the art is the intangible, subjective, and humanistic side of care that involves navigating the nuances of human emotion with our healing presence, right? That's a lot of words. But what I mean by that is we carry healing on the inside of us, right? And we treat patients with that level of attention and care. Sometimes you may not know what to do for a patient, but you have that presence to offer them. That presence is healing. That presence can bring healing, can bring wholeness to them, even without getting rid of their actual disease. I don't know how many of you have talked to someone who just had a way about them, and they may not have solved your problem in that moment, but there was something that you took away from that conversation that left you feeling lighter, that left you feeling more whole. So that aspect, that is the art of professionalism. Okay. Now, I want you guys to know that when we combine these together, this is just a visual image to show how the science and art really kind of work hand in hand, right? The knowledge, the competence, the ethics, and the empathy, the communication, the appearance. And if you notice, some of the things you guys mentioned are in this Venn diagram, right? Dr. Moore mentioned appearance. Dr. Akintade mentioned ethics and our duty. And so all of these things combine together, and when they're put together, you can actually achieve professional excellence. Okay? All right. So let's begin talking about the actual science. I've given you guys sort of a broad overview of what professionalism is, about the two pillars that make up professionalism. Let's begin talking about the science, okay? Now, when we talk about the science, what we're talking about is your knowledge base, your competence, right? Now, with your knowledge base, understand that knowledge doesn't begin and end when you're in the kind of protected environment of learning, of a learning institution. We must continue to grow in clinical competence. We must continue to build our knowledge beyond the classroom. What does that mean for us as a professional? That means staying up to date, staying proficient technically in and out of our academic settings, right? What structures, what systems are you putting in place to continue building and updating your knowledge outside of those four walls of formal education? Are you curious to know? Are you a lifelong learner? If you are in the field of maybe school nursing or community health nursing, for instance, what efforts do you make to stay abreast of updates to clinical care or like newly emerging technologies, attending seminars that may help to expand your scope, reading a journal here and there, networking? What is your investment in your own continued education? Those things are so important. Staying engaged with the new research, the trends in nursing and other fields, right? We have to remember that we are in a competitive landscape with multidisciplinary teams. And the way that we present, the way that we show our knowledge base is by continuing to educate ourselves. So this doesn't mean that you spend all your time reading a journal or the other, but what this can look like is maybe every month or so you're subscribed to a journal, and every month you read their summary for what's going on in your specific area of interest. It doesn't mean you have to read about everything nursing related, but you can read what is going on in your own specific area of interest. To be a continuous learner is key for professionalism. Now, why is this important? And if you can see on my notes, I said that it cultivates a reputation for you as an informed and a competent nurse. When you are being seen as somebody with authority on a topic, on a specific subject, the people around you recognize that, and the other parts of the other members of the multidisciplinary team, they come to respect you as a nurse and nursing as a profession, right? So I know I'm talking heavily on nurses because I don't know, but please, by all means, I'm talking about every single profession, right? So for instance, imagine being in a discussion with, your colleagues, right? And you're talking about something, an interest, an area of your specialty, but you have no idea what is going on. You have no idea what they're talking about. That says a lot about you, and that will say a lot about your profession because they're going to think, nurses, they don't really read. They're not really thirsty for knowledge, right? Physicians, our physician colleagues understand these very well. They are always actively engaged in one seminar or the other, one research journaling or the other, one publication or the other. They are constantly looking to improve in that way. So we must understand that if we are not competing on the same level, and not just for competition's sake, but for bettering our own selves personally, it leaves our profession looking like we don't really care for professional development. So making sure that you are constantly building your knowledge, making sure that you are one step better today than you were yesterday, right? Attend a seminar like what you're doing now, right? This is perfect. A continuing education, it can be every month, every 3 months, every quarter. These are ways to be active learners, and this helps to build that reputation of somebody who is a competent and informed healthcare professional. And this diagram it's what we call Miller's pyramid of clinical competence. And so it pretty much breaks down how knowledge grows, right? So first you know, and then you know how, they basically call competence, and then you show how, and then you do. And so kind of builds up on your knowledge base. Okay, poll time. I have a question. So everyone, get your fingers working. We're going to take a poll. So the next thing I want to talk about is professional organizations in terms of the science of professionalism. So my question is, how important is joining a professional organization to you? Number one, super important. I've gained so much since becoming a member of mine. Number two, I would like to join, but I find the membership dues to be too expensive and I don't know which one to join. And number three, not important at all. I don't see the point. So please take the poll. You can just say one, two, or three in the chat, and I will wait. Perfect. Thank you. Perfect. Perfect. Thank you, guys. I see your responses. So Titus said number one. Dr. Moore, you said two. Clara, one. Dr. Akintadi, one. Perfect. I'll give you guys some more time. Okay, so I think the prevailing response is one, right? That it's super important, and I've gained so much since becoming a member of mine. And of course, there also are the concerns that, I want to join, but I don't know which one to join. There's just like way too many out there. And how do I know? How do I know which one to join? And also, they tend to be so expensive. Um, and to this, I would say, number one, find something that you feel passionate about, interested in, if that's advocacy, if that is, civic engagement, policy making, if that's education, if you're interested in nursing students, all these kinds of things. First and foremost, find out what it is that you're interested in. Okay, I got some more responses. Princess One is and ODJ one as well. Okay, so perfect. I'm glad that people find that joining a professional organization is important. And I would be lying if I said I didn't share your concerns with number two, because at times you look at these organizations and it feels like one is just the clone of the other, and they pretty much have the same exact purpose, a mission, and you're not sure why one is different and why they even had to have another one when this one does the exact same thing. So I quite understand that. Pick which one you feel most interested in. Pick something that kind of really brings you joy and you feel passionate about, and join that one. And now, while the dues might be an issue, you can talk to the what do you call it, the leadership of that organization, because you just never know what kind of scholarships that they might be able to provide for you. Can also be going through your employees. Some employers will actually fund your organizational dues. So look into those options if this is a big thing for you and you truly want to be a part. I always try to join something whenever I moved. I just moved to my state, and not long after I moved, I joined the state organization locally. And I think that with the way information is shared, the journals that they send out, I always find something valuable, something meaningful, something updated. I keep in touch with my LinkedIn connections, just keeping my feet here and there just to know what's going on around me is important for professional development. Okay, so let's talk about the power of professional organizations. Okay. I saw this post on LinkedIn recently, and actually saw two different posts, but this is one of them. And it says, if you're leaving your professional development up to your employer, you'll be in a sorry state. Take personal responsibility for your own career and be proactive with it. And this really spoke to me because a lot of times we we're busy, we are tired, we don't want to think about one extra thing to do. But the truth about professional organizations is that it allows you to have a we versus me mindset. It allows you to have a community of people that you can work together with to bring about a certain change in your community, in your profession, in that niche that you are deeply interested in. It allows you to rub minds with people of like minds and like interests, because the goal of us in the healthcare profession is not necessarily just to make some money and go home. We want to make bigger impact, local impact, small scale impact, global impact. We want to live a life that is meaningful. And when you want to go far, you always want to go together. So it's important to have that community for that purpose. Professional organizations provide networking, opportunities, resources, and professional development. And like I said, they offer the benefits of collective action versus solo efforts. Again, even from the phase of being a student, right? I remember being a part of the NSNA, which is the Nursing Students National Association, and they would have organized events local to our chapter. Those things built community. They allowed us to talk about what could we do in nursing, and we brought up things like the peer mentorship program, how we can make our clinical rotations better, so from a very tender point in your clinical career, in your nursing career, you can already begin to make changes. You can already begin to advocate for better in nursing. You must not wait until you are a fully fledged career professional before you start to advocate for those little changes to be made. So lastly, being a part of an organization encourages you to get involved in advocacy, right? And community. And, of course, we are supposed to be community leaders. So this gives us an avenue for expressing that aspect of nursing. Imagine if you were, for instance, in a city in Nigeria, and on your heart, you truly wanted to provide clean running water to this community, to this maybe a small town or small village or something. How much more effective would you be if you could band together with the nurses in your community, in your organization, in your professional organization, and make that dream come to pass? That's what professional organizations offer to you. And so that's that for professional organizations. That's another science of professionalism. The next thing I want to talk about is something that Dr. Bim mentioned, which was duty. And I term this ethics and leadership, right? And the reason why I want to talk about this specifically is because as leaders in our field, as people who have been in this field for 10 years, 15, 20 years more, we have an obligation. We have an obligation to show the younger ones, the early career professionals, the true definition of professionalism. And we do that by example, right? So let's first talk about ethics. What I define as ethics is your moral compass. This is a science of doing the right thing, right? It's the science of doing the right thing when no one is watching. It is a science of integrity towards your patient at all times. This is professionalism, right? Patients are watching. Somebody else may not be seeing you, but professionalism occurs with or without watching eyes, right? So again, it is not just about complying to your HIPAA laws, but it's protecting the dignity of your patients, right? The way you discuss about your patients, how you manage their privacy, all of these things impact upon your professional image. I called ethics integrity in action. So your integrity as a clinician really showcases the excellence of your professionalism. Okay. All right. So Princess said ethics, it refers to the standards that guide healthcare professionals in providing safe, respectful, and responsible care to patients. Yes, that's correct, Princess. And thank you for sharing that. The key words here are safe, respectful, and responsible, right? And so making sure that whatever we do for our patients is safe, whatever we do for them is, we've heard a whole lot of stories about medical negligence, lawsuits, people putting patient information online on social media. I mean, those are the things that we cannot be caught doing as professionals. That definitely tarnishes our image in the landscape of professionalism. Okay, so when we talk about leadership, we're talking about being a leader even without a title. It means that your responsibility, your professional responsibility, is that you're lifting people as you climb. And it doesn't mean that you have to be at the very top in order to lift. As a student, right, when I was in my, I want to say, third year, that was when I started the peer mentorship program in my university. I started mentoring first and second year students, teaching them what they needed to know before they started in their clinical rotations, teaching them what they needed to know about this class or the other. It was just from my tiny knowledge. I wasn't like, I didn't know everything, but I felt called and I felt compelled to pour into the younger ones. And so, from that point of view, you could say I was a leader. I was only a teenager, right? I was young at that. I didn't know, I didn't know everything. So remembering that leadership does not necessarily mean that you have to have a title. It is mentorship, it is legacy, it is lifting as you climb, and it's teaching the the junior staff, your junior nurses, the people that are subordinate to you, um, that it's not about hierarchy. It's not about, oh, I am, I'm higher than you, but showing by example, by the way that you relate with them, by the accessibility that you offer to them, by flattening that hierarchical curve, by your conflict resolution, by your own interaction with patients. This is how the ones coming after us will begin to learn. So it's like that phrase, oh, the nurses here, they're rude, they're this, they're that. We have a responsibility to begin changing that landscape for the younger ones to emulate. And so that is our professional duty as well. Okay. And that exemplifies true leadership. All right, so I'm going to start to talk about the art of professionalism. That's where I want to transition to next. There's so many other things involved in the science, right? But I've kind of lumped them all together to education, to competence, to research, to leadership and ethics, and now to, to professional organizations. But there's so much more to it, right? This is just me condensing the information. But let's move on and talk about the art of professionalism, right? So, when we talk about the art of professionalism, the first thing that comes to mind is advocacy, right? Being the patient's voice, being the patient's proxy, standing in the gap when the patient doesn't have, the ability to do it for themselves, when they are vulnerable, when they are incapacitated, being that art, being that voice for the community and for the patients, right? Now, advocacy goes beyond just the patient, right? If we step back and really zoom out, we see the macro view that we are here to actually nurse our community at large. So while we are the patient's voice, we are also the professional voice. We need to be using our expertise to inform policymakers, to transform the landscape of healthcare, our policy, understanding that if we don't do it, non-clinicians will do it. People that have no clue what's going on in the healthcare space, they need our voices in order to make laws and rules that actually regulate our practice for our own benefit, right? So I use the term civic professionalism, and that just means that you are a public facing nurse or healthcare worker that carries a responsibility to improve community health outcomes, right? And so some people might say, oh, I'm not a politics person. I'm not a health person. I'm just going to leave that to the big guys to do. But the truth is that one person can make a difference. Your voice can make a difference. Your involvement can make a difference. Your canvassing can make a difference, right? So never think to yourself like what I do doesn't really matter. Nobody's listening to my voice. You have a responsibility to your community. And this is why I'm so proud of, Health for Nigeria, because Dr. Akintade saw a need that needed to be addressed and didn't say, well, that's the government's job. Like, I don't really need to be involved in that. This is him stepping into the art of professionalism. This is him stepping into the heart of healthcare and making an impact where nobody, otherwise others would think, well, it shouldn't be our problem. He made it his problem, and he's an advocate in that sense, right? So it extends to the laws, it extends to the community, it extends to the things that govern our care. And again, don't do things alone. This is why it's also important to join an organization, because those organizations are lobbying, those organizations are pushing for change, and you can hang your name on those, be a part of those organizations and play your role in it. If nobody does it, then nothing ever gets done, right? Somebody needs to step forward. The other thing I've noticed is that, and this is just like a sidebar, but every time you would hear, oh, there was a healthcare campaign or healthcare lobbying going on in Washington, D.C., or something of the sort, it is largely physician heavy, right? And you hardly ever see nurses getting involved. Why is that? Because I think part of the education we receive is it hasn't been ingrained in us that we are citizens first, right? Physicians are trained to know that they are physician citizens. They are not just citizens. They are supposed to know things on a global perspective. It's been ingrained in them that you are beyond just what you do in the hospital. Get involved in policy, get involved in your community, write a research paper, do this. These things, these values are ingrained. So I think until we begin to ingrain civic engagement in our nursing curriculum, or just make it a big point of education for our staff, our nurses, people that we interact with, it really won't sit. It'll always look like a peripheral activity rather than one that should really be ingrained deeply within us. So if you guys take something away from this, especially our nurses who are in Nigeria, understanding your civic role, understanding your civic duty to your community and to your profession, and don't disjoint that from the work that you do, because again, this is part of the art of professionalism. All right, poll time. I think some people like this poll. Okay. All right. So, what is your philosophy on the relationship between physical appearance and professionalism? Number one, I think it makes a huge difference to our professional image. So, slogan that goes, dress how you want to be addressed, comes to mind. Number two, I'm not sure it matters much. As far as I'm competent and caring, people want to be taken care of. They are not looking at my outfit. And number three, I haven't thought much about the relationship. All right, so I'm going to give you guys time to respond in the chat. 1, 2, or 3. Yeah, Titus says 1. Dr. Akintade says 1, absolutely. Dr. Moore says 1. Yeah, perfect. Princess said 1. We should give out prizes at the end, Dr. Akintade, for all the people who are active in the chat. All right. Thank you guys so much for responding. Titus is always looking sharp, so I know it's 1 for him. All right, Clara says 1. Very good, very good, very good. All right. So think about the people that you have a lot of respect for. It can be a celebrity, public figure, political figure, whatever. Think about the way that you have seen them carry themselves, right? Do you feel like that makes a difference in sort of the way, does it play a role in your admiration for them? That may not be the reason why you're drawn to them, but there is a subconscious understanding and a subconscious thought process where when you see a person visually, you form an initial opinion about them. And if the person is always disheveled, always unkempt, does not care for their appearance, how would your view about this person change or not? Right? So you can also add that into the chat. I'm going to look. Okay, perfect. So Princess says, Physical appearance creates the first impression that people have of a professional. A tidy appearance can build trust and confidence. Yes, Princess, you read off of my slides, basically. So maintaining good hygiene shows discipline, responsibility, and respect. That's perfect. That is exactly right, Princess. I think Princess should get that prize. Um, but yes, that I mean, that's exactly right, right? And that's what I'm going to be talking about next. And so another art is physical appearance. So let's look at this again, this image. It's like Donna knew I was going to be presenting because all her posts in the last couple of weeks were all about, all the things I was going to be talking about. So I was just like stealing off of her LinkedIn page. So this says, always dress well at work, whether wearing scrubs, uniforms, a business suit, or business casual. Develop a professional image to match the professional person that you are. Your appearance makes a loud statement about who you are. You have to inspire confidence in others and yourself. So, very key, right? And it doesn't take a whole lot to appear. We're not saying that you should invest in Louis Vuitton or, the latest hair or whatever. It's just about decency and the way that you carry yourself. And so that's what I want to talk about next is physical appearance. And I don't want you guys to underestimate the importance of this physical appearance. Patients are always watching. They're always looking at how you present. And the way that you come in and the way that you sort of carry yourself helps to build trust and confidence in you as a healthcare professional, right? So this can look like taking care of your physical health, your diet, your clothes, making sure that they're clean, they're well pressed, your nails, making sure that they are, not long and obnoxious, they're not chipped, making sure that your shoes are clean and tidy. Um, Making sure that your hair is neatly done. Personally, I wrote this in my slide. I'm not a big fan of Crocs to work. I know some people just like wear and they wear open-toed shoes. Please keep in mind that first of all, you should not be wearing open-toed shoes to work. And open-toed shoes means like sandals, anything that keeps your toes open. And I believe Crocs have like holes in them, but they're just not a professional look. You have just wear a pair of sneakers that are clean. Those are the ways that we should be presenting. And it doesn't matter what setting you're in. Some people seem to think, oh, I'm just in a village somewhere. I'm just in a little hospital somewhere. Nobody really cares. It all counts. It all matters. Nothing irks me more than when I watch a show and there's a nurse on the show, and the doctors are well dressed in their white suit and looking professional. And the nurse is just, I don't know if you guys ever saw this show by the Mindy Project. I watch all the shows that have nurses in them because this is my business. So the Mindy Project had some very, I wish I put a picture in here about them, very unkempt, terribly presenting. They presented these nurses as like what do you call it, dumbos. Like they really didn't understand anything, knew anything. They were just laughing stocks. But these are some of the pictures that we see of nurses, and nobody ever shows like a nurse like Titus, who is sharply dressed every day of his life, or Dr. Bim or Dr. Bridget. We always only see the images of, the nurse who is disheveled. And so please, in our own little way, let us try to change that image, that physical appearance image, your hair neatly done. We're not trying to infringe on your personal style by any means, but understand that professional is professional, and we must make sure that our professional image speaks highly of our profession. And finally, I just, said that you're telling a story about yourself, and you can inspire trust or distrust by your physical appearance alone. And people are always, always watching. Alrighty. Now, this is a research article that I pulled up, um, and it's very recent from October 2025. And it was talking about the relationship between physical appearance and patient judgment. and patient overall satisfaction. Now, this says that when a patient steps into a doctor's office for the first time, immediately they begin making judgments about the care they are about to receive. And one of the first things they notice is the physician's appearance, with 53% of patients reporting that the doctor's attire is an important factor in their care experience and it influenced their overall satisfaction. Can you see the mental relationship that people draw just from your appearance alone? You haven't even said anything, but they're already making judgments about the kind of care they are going to receive. So the last, not to read the entire thing, but the last sentence says that your initial presentation signals to the patients that the doctor, and in this case, the nurse or any healthcare professional, takes their role seriously and creates an atmosphere that they are committed to providing the best care possible. So understand that these things matter. It doesn't just matter because the patient is going to think, oh, she's cute. No, it matters because they think if this girl doesn't even take care of herself, how is she going to take care of me? If she walks in here with nails as long as what I don't know, how is she going to? She probably is more interested in her appearance and looking fashionable than taking care of me. All these thought processes are already swirling in the mind of that patient, and you haven't even said a word. So please remember that these things matter. Your professional, your physical appearance matters. Okay, poll time. We're getting more and more polls. I think we're probably down to this is our last poll. All right, so the next thing I want to talk about is social media use, right? In professionalism. So first, the question is, what are your thoughts about the impact of personal social media use on our professional image? Okay. Number one, my phone, my choice. Once I leave my place of work, whatever I do on my personal time is my business. Number two, I'm careful with what I post, but I still don't think the two should mix. And finally, there is a clear relationship between professional image and personal identity. Why couldn't our NCLEX questions be this easy? By the way. um, People subconsciously blend the two identities together, especially when they know what you do for a living. So let's have you guys' response. Please be honest what you think, okay? Where is my chat? Wait, hold on. Let me get this out of here. Oh, there it is. Okay, so here we go. So 3, I remember my first day. Oh, okay. This is from our previous one. Wonderful. All right, I'm gonna read our previous. Okay, perfect. Thank you. Titus, you had talked about the physical appearance. He said on his first day in nursing school, they were taught how to put light powder on, ladies on how to pack their hair as non-touching. So I guess you were trained on your physical appearance from an early age. Okay. So I see a couple of people saying 3, some saying 1, some saying 2, and Princess saying 1. Okay, perfect. So thank you guys for sharing that. For those that said 1 or 2, would you share some insight into your thought process and why you believe that it's your phone, your private life, that it doesn't matter. If you want to just type in the chat and then I'll keep on kind of talking, okay? So especially when people know what we do, it's important that we understand that there is always that connection drawn, right? I know in this world, in this Gen Z world or whatever that we live in, people feel like they don't need to answer to anyone or they don't need to explain their social media presence to anyone. And while that may be true, and your employer might not be requiring you to share anything or look a certain way or do whatever you want, but we are talking about how this affects the profession in general. right? How this affects the profession that you represent, because believe it or not, you represent a profession, right? You may not know it, you may not understand it, but you represent a profession. And when people know what you do, it makes a big difference. They always draw that connection. People will say things like, oh, we saw that nurse outside. She was fighting with some lady. They won't just be like, oh, we saw Bridget outside. She was fighting. They always say, oh, do you know what that doctor did? Oh, my goodness. Why did they say, do you know what that doctor did? While it might be an identifier, like a way to identify who they're talking about, they've already put your profession in there as what you did or what you didn't do. So you have to realize that when you post on social media, you're not just you, especially when people know what you do. You are a representation of your entire profession and healthcare system. So a single unprofessional post can lead the public to question the competence and ethics of your profession, right? We don't want you not to be yourself. We want you to be yourself and have your individuality. But remember that your digital self has to always align with the level of trust your profession demands, because people will lump that thing together. And if they hear that story two or three more times about a nurse that gave the wrong medication, or about a nurse who did, all of a sudden the story becomes, oh, nurses they always fight outside just because two nurses did it or because three nurses did it. They don't see the other nurses that haven't done it. They just automatically say, oh, nurses do. Like that's what the immediate repercussion becomes. So it is so important to understand that your professional life and your personal life, especially what you do in the open, in the public, are completely interconnected. And there is really no way to separate the two. Now, are we saying that you shouldn't post like your children or something about your personal life because you're a nurse? No. But what we're saying is like, be professional in the detail, in the standards of what you share. So small choices like, poor grammar.
So something that I put,
Huh?
I was just going to say, I put it in the chat, but like I was a teacher when social media
Oh,
was
yeah.
really becoming very impactful when
Yeah.
teachers go on vacation and post different
Hmm.
things that they were doing. And they
Yeah.
were like, oh my gosh, that teacher is doing what?
Yeah.
And it ended up, they ended up getting fired
Oh,
or,
yeah.
being removed
Yeah.
from their position because
Yeah.
what they were posting on social media.
Yes, absolutely. That's
Mhm.
true. And employee, I was reading a post yesterday to this point that you made, Dr. Moore. I was reading a post yesterday, and somebody had already gotten a job offer, and they went online and saw their profile picture and rescinded the job offer just because the profile picture was unprofessional, although it was on a professional platform like LinkedIn, so that was more important, right? But the picture they had on LinkedIn was an unprofessional picture, and that offer got rescinded, right? So thank you so much for sharing that, because people don't really understand that there is a connection. Thank you, Dr. Akintade. You said individuals in high profile roles no longer post personal information. Exactly. Because we are ambassadors of our organizations and profession. Exactly. And Clara, when you're professional, what you post is important. Employers have policies on social medias that employees are expected to adhere to, right? So when you post things in the public, it's no longer personal. It's become public, right? So if you don't want it public, do not post it. If something comes up and there's a debate, be careful with the tone of your words. Don't don't lash out. Don't be harsh in your tone. Do not, use vulgar words. Do not be derogatory. Always remember that you are a representative. You are an ambassador of whoever it is that you represent, and in this case, it would be your profession. Okay. And so when it comes to professional, detail standards, especially when it comes to like LinkedIn or other professional websites, making sure that you have a clear picture, Your picture is not blurry. You're not like wearing like a crop top or whatever, or something that doesn't look professional. Making sure that your name, this is one of my pet peeves, that your name is not in all lowercase, or you have poor grammar. All of these things can signal a lack of attention to detail and a lack of respect for your clinical role. So when you are creating like a LinkedIn profile, for instance, and I'm talking to, especially the younger nurses, wherever you are in Nigeria, wherever, when you're creating a LinkedIn profile, make sure that you're paying attention to these details. Don't put a profile picture that has excessive makeup or, excessive eyelashes, or, you have a picture that doesn't have like a professional undertone to it, or your picture is blurry, or you write your entire name with lowercase letters, or you spell things wrong. Make sure that you are paying attention to detail. These things matter a lot. People are watching you beyond what you can even think. And one bad impression, that's it. You don't get a second chance with a lot of people because people are busy, right? They look at your profile and the first thing they see is, oh, this person's picture. It's better you don't have a picture there at all than you have a bad picture, or you post something that is, that is, like that is a vent, or that is aggressive. It's better you don't say anything at all than you communicate in an unprofessional manner. So please make sure that you are carrying the same level of composure behind the screen, as you do at the bedside. That's the key. Okay, so I want to give you a pro tip. So before you hit post, ask yourself, if my current or potential employer or even my patient reads this, would they still trust my judgment and professional character? And before you hit post, always think about this. Always ask yourself this before you post the next picture, before you post something that's vulgar or derogatory, or you engage in media wars. Always ask yourself that question. Represent yourself well. Address yourself. Act the way that you want to be addressed. All right. Our next art of professionalism has to do with emotional intelligence, culturally competent care, and teamwork. Okay. So, emotional intelligence, I know we've heard this term over and over again, right? But it is the ability to recognize and regulate your own emotions while navigating the emotions of others. This is a key, I cannot overstress this. It's a key ingredient in the way that we care for our patients, in the art of professionalism, right? We are always going to be burdened. Well, I shouldn't say always, but there will be times when we have stressors, things that we're dealing with, and we still have to show up to work. We still have to make our patients feel seen, feel heard, treat them, all of this stuff. How do we navigate our own emotions while we are trying to take care of the ones that we're called to serve? This is where emotional intelligence comes in. And emotional intelligence doesn't just stop with our patients, it carries over into our colleagues, the people we interact with, in our setting, in our clinical setting. How do we communicate with others, right? Our communication says a lot about our professional integrity and our professional excellence. Okay. Next thing is our cultural competence, right? Professionalism means that every patient is culturally diverse, and that may not mean the color of your skin or your native background. It may just mean diverse in experiences, diverse in life story, diverse in set of beliefs, right? Always making sure that we are treating the person, not just the diagnosis, because our goal is to build real trust with our patients, right? So always see our patients as not just a task or a number. Use their names, address them face to face. Even if they're children, right? Like in a school, the way Dr. Akintade has these schools in the clinics, even if they are children, they are still worthy of our dignity. They're still worthy of our cultural competence. They're still worthy of our emotional intelligence. The way we talk to people whether they are children or adults, whether they are above us or below us, matters a whole lot. It says a lot about your character, and it says a lot to others about your profession. So please be mindful when you're communicating. It's a big deal. It's a big deal in healthcare, in any field, but most importantly in healthcare, because the ones that you are communicating with are the most vulnerable that they will be. They are sick people, they are vulnerable. So the way that you address them matters beyond anything that you can ever imagine. Nobody wants to come into a clinic and be met by a grumpy, angry healthcare professional. You've already taken half of their care away, just by that attitude. So please, emotional intelligence and cultural competence are key ingredients in professionalism. And then finally, teamwork. I want to talk about that because, you know, when it comes to interdisciplinary teams, I want people to understand that professionalism is not just yes, sir, or no, sir. It's not subservience. It is mutual respect across all disciplines. It means rejecting outdated hierarchies and taking up more of a collaborative environment where every voice is heard, and we're doing this for the sake of patient safety. The hierarchy should be flat when it comes to patient safety, but it needs to be deep when it comes to shared expertise. The goal is patient care. So making sure that in a professional setting, there is no subservience, but there is partnership. I know that like in the Nigerian culture, for instance, we're getting better. We're, much better here in the States. But in the Nigerian culture, there is always this like battle of the professional, right? This person is higher than that person. This matron is higher than that matron. And it really shouldn't be that way. There should be a collaboration. It doesn't mean that you shouldn't respect those who are above you. Corporately speaking, of course, there should be that. But professionalism means that we work together, that we're not abusing our subordinates, that we are not disrespecting those that are below us, but we are working together for the sake of patient safety. Okay, so that kind of brings me to the end of talking about the art and the science. However, I understand that we don't live in an ideal world, and we deal with real life problems, personal problems, government problems, like institutional, structural problems. So I want to take some time to address some of the barriers that may present when we have the best of intentions to practice professionalism, but we find ourselves falling short, right? So what are some barriers to professionalism? The first one I made a note of is information overload, right? So I'm talking about making sure that you are continuing your education outside of the four walls of a classroom. But sometimes medicine can move so fast that staying current feels like drinking from a fire hose. The information is constantly coming, things are constantly being updated. And when you're overwhelmed by new data, you just stick to the outdated habits that you're used to. The next thing is resource scarcity, right? We don't live in a perfect world. And especially in our developing countries, for instance, Nigeria, you can't practice gold standard medicine if the equipment is broken, if the medications are on back order, if the basic amenities don't function properly. And unfortunately, these are the things that plague our country, right? I'm talking about Nigeria right now. These are the things that plague us in a country where resources are not abundant, right? That we're provided with, at least. They're not abundant. The structures are dilapidated. We sometimes deal with light scarcity, water scarcity. Everything is just scarce, right? And you have to continue to treat patients under these gruesome conditions. Um, and when you are dealing with these, you really don't have the time, you don't have the wherewithal, you don't even have the staff, you're right, to follow these safety checks and these safety measures and protocol to keep your system running smoothly. So that's another barrier that I identified. Another one is burnout. We all know this word all too well, and compassion fatigue, right? When you are drained, when you're physically tired, mentally tired, worn out, the art is usually the first thing to go. In an emergency situation, nobody's thinking about the art. We're just like, let's get it done, let's focus on the science, and let's go. So it's very hard to be empathetic. It's very hard to be polished when you're drained, right? And then you have to sacrifice one thing for the other. And at that point, your professional excellence drops because the art of professionalism goes right out the window. And then finally, I said that was a high pressure environment. Again, a fast paced environment, right? That prioritizes speed, 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 speed will lead to friction. And it can happen between the team members, and it can even cause us to be cold toward our patients because we're so overwhelmed and overburdened. All right. So, having talked about this, I do want to talk about some strategies to tackle these barriers so that we're not looking tired, worn out, beat up all the time. So just a few strategies to tackle these barriers I want to present. So the first thing about dedicated learning, like I said before, excuse me, oh, I need water. You don't have to know everything. You don't have to read everything. Take that pressure off yourself already, right? Small steps every day are more important than one huge step that puts pressure on you. So you might subscribe to one or two high quality journals that are relevant to your field and read updates about them every month. Or you can set aside 30 minutes once a week specifically for those updates. Progress is more important than perfection. The idea is that you are doing a little bit every day to improve and to be better. So that's about continued education. That's about the science. The second thing I want to talk about is prioritizing the critical path. Thinking about what are your negotiables and what are your non-negotiables. The idea is to take the burden off of yourself, right? When your staff is short, explicitly identify the things that are non-negotiable, like making sure that you're double checking meds to ensure patient safety. That's a non-negotiable, right? Because that is the difference between safety and non-safety for a patient. Let the things that are nice to haves go without guilt. You may not spend the extra 5 minutes that you would normally spend chit chatting with the patients. You may be rushing in and out. But even in a rush, there are little things that we can do to continue to make our patient feel seen, referring to them by name. You can tell them, hey, you have a busy day, you might be in a little bit of a rush. This takes zero extra time, but it continues to keep you anchored to the art, right? People can see you're busy. You don't have to squeeze your face in order for them to know you're busy. You can say, hey, Mr. Moore, I'm rushing, I'm in a rush, we have this, but I'm here to take care of you and I want to do my best by you. Patients appreciate that more than you just being quiet and giving everyone an attitude and just rushing around the room to get your work done because you're busy, right? So make sure that you can prioritize what is important and let go of what's not important and do it without guilt because you only have a limited amount of resources, of people, and there's not so much you can do about that. But what you can do is to prioritize what's important and let go of the things that are not critical. The next thing is micro restorations, right? So I wanted to just make a point to say, I know sometimes we don't even have 2 seconds to do this, but once you can find, even if it's 60 seconds in the break room or the bathroom, just go in there, take a deep breath, you know, get some oxygen into your brain. That physically actually makes an impact. Scientifically, it lowers your cortisol levels and it allows that stress to kind of be released for even half a second. I know during COVID, I was in New York, it was busy. There was like no time to rest, no time to break, no time to pause, no time to do anything. But we would just take little bits of time and breathe and, just woosah a little bit. And even that, you can come back to it and have a bit of a clear mind and a bit of a clear head, because you cannot pour out from an empty cup. So making sure that you are taking time to restore yourself. And then finally, when it relates to social media interactions and even, real life interactions, making sure that you're responding wisely before you make any sharp comment, before you spout off. Pause for a few seconds. This slows down that impulsive thinking. It prevents you from saying something that you'll regret, that you'll have to apologize for later. So sometimes even being silent is the best response. So these are just 4 strategies that I picked out based on some of the art and science points that we had made. And I wanted you guys to, consider these whenever you are going through a stressful situation, making sure that you respond wisely, what you post on social media are professional, taking time to dedicate for learning and continuing education, making network connections with people of like minds, um, and, again, taking those micro restorations when you need it. So finally, I wanted you guys to know that professionalism is not a sprint. It is a daily decision to make one right choice at a time, one day at a time, 1% better than you were yesterday, knowing that it doesn't happen overnight. But 1% better is the goal. Just 1%, not 2, not 3, not 5, 1%, a little bit better than you were yesterday. Just a little something that you can do today that you couldn't do yesterday. That's the goal. So, what is your 1%? What aspect of professionalism can you implement in your own practice today? And you guys can feel free to write in the chat something that you feel will make an impact, something that you feel, you haven't been doing in the past, something that you have been doing that you would want to continue to do or even improve upon, right? That would really make a difference. Thank you so much. I'm looking at you guys' chats right now. Yeah, absolutely. Cultural competence is the ability of a healthcare to understand, respect, and effectively interact. Thank you so much for sharing all of these today, Princess. I appreciate it. And everyone else. Okay, so that really brings me to the end. I would like to just kind of give you guys my quick summary. Again, professionalism moves beyond being just polite. It is not just, oh, I talk to you with, a nice tone. While that's a component to it, really it's a combination of clinical competence. Please, let's not forget that piece because it's a big piece. If we're just nice and we're not competent, then we're not of no use to our patients. And if we're just competent and we're not nice, then we're not healing their soul. It's a combination. Put both of those things together to give us the utmost professional excellence. It is a silent, unspoken contract between the provider and the public. It can be expressed even when we're not directly communicating with patients. Like we said, the nonverbal cues, the way that we present, the way that we carry ourselves all reflect on our professional image. And excellence in professionalism is achieved when we don't lean too far away from one end of the spectrum. Rather, we sustain a balance between the art and the science. Thank you. Alrighty. So I'm open to take questions. I know we probably have gone way past our time. I'm not even sure what the time cap was, but I'm open to taking questions.
That was an excellent presentation. Titus, you want to do a Q&A?
Thanks for the clap, Titus. I see.
Yes, thank you so much, Chinelo. Actually, nice meeting to you again.
Yes,
And
nice
it's
meeting
really,
you.
really awesome to see your face here. And what you have told us today has been very, very impactful to all the attendees, and including myself. And I know all of us have some great impact of your presentation. Professionalism is the hallmark, and it's not until we get to the role of CEO or COO or whatever, it starts where we are. wherever we have those little assignments, wherever we have those opportunity to work, it begins from there. And just brought me back to when I was a little baby in nursing or from my day schools. Once you have this habit, it goes a long way with us any day, anytime, and it gives us this clarity of purpose. And it's a really, really nice one. But I want to ask you one question. Overall, then, before I believe everybody's preparing their questions right now. Please, you can put it on the chat, but I will see if you can raise it by show of hands to verbally ask our presenter your questions. If not, you can put it in the chat as well. My question is, despite the fact that the professionalism is important, even globally, I'm still seeing the trend whereby people, not only, when people are coming, when new staff are graduating from school, they are kind of top notch because in school they are not doing it because they're not going to possibly graduate. But the moment they step into they just relapse. I don't blame them because I see some other trends, whoever is precepting them or stuff. But in the higher level, some people don't really care about it. What is preventing them from just being professional? Is basic, just be professional, right? What are those? I know you mentioned a lot of barriers for us today, but what are the things at the not the executive level, at the mid-class level of our profession, especially in nursing, that is preventing people to just be Nigerian. I'm just using that as a opener, so please be preparing your slide and you can raise your hands or you can put it on the chat. We're monitoring it. Thanks. Generally, you can proceed.
Thank you so much, Titus. Wonderful question. As you said, a lot of times when we are first introduced to when we are first entering into the profession, there is such an excitement and a longing to do better, to do something great, right? We remember all coming into nursing and we were already thinking what we can change, what we can modify, what we can, identify as issues and quality measures that we can take. These things are really the lifeblood of any profession. People might think, you're still young, wait till you get in, you'll see what happens. It is that attitude, right? And that culture of really not maintaining that zeal and that passion that allows it to begin to fade away into the distance, right? So by the time you've come into the profession and you meet a culture where people are not hungry for excellence, you inadvertently, it's like one rotten egg spoils the bunch, right? That culture that spirit and that fire that was inside of you really just begins to fade away. So what it takes is a leadership culture of professionalism, teaching our nurses and our staff, this is how we conduct ourselves in this clinical setting, in this professional organization. These are the things that we do. These are the things that we don't do, down to talking about patient information, down to, gossiping, down to the way that we treat our younger ones. And this is why that slide on leadership and ethics was so important, because as we enter the profession, we have an opportunity and we have a responsibility to draw the next generation in the way that they should. That's why I love these quarterly guest lectures, because what it does, it continues to remind our nurses that you are in a profession. You're not just here to receive a paycheck and go home. You are in a profession, right? Nursing is not it's not a blue collar or menial job. It is a profession that is guided by laws and bylaws and ethics, right? So I think a lot of times what happens is that when the culture within the healthcare space that person works is not maintained and it's not ingrained and it's not sort of consistent, people tend to just relax and they lose that initial passion, that initial fire that they started off with. And so I think that's where we need to step up and enter into that education, continuing education, continuing to train. We don't just train, oh, how to give an injection or how to use the newest EMR, but understanding that we can train about how to maintain a culture of true professionalism that will keep the fire of our younger ones burning long after they've been in the profession.
Thank you so much. Dr. Bill,
All right, so Nello, this is a question people ask me all the time, and it's a question even I have for others from time to time. One of my colleagues is here, Mrs. Ifeoma Babatunde. She lives in the UK. She and I served on an executive committee before, and we experienced some similar challenges. Um, Over the generations, some of these expectations have changed.
Mm-hmm.
Yes, I mean, the Gen X, the Gen Zs, and we're not expecting that what happened 50 years ago should be the standard today.
Mm-hmm.
But there is a clear difference in the understanding and expectations of professionalism for young adults today. So how does one bridge that gap? This is largely focused on nursing, even though we know this is for all professions,
Mm-hmm.
but when you have a young professional who's smart, intelligent, they know what they're doing, but they don't see the value in a lot of the things you said today,
Mm-hmm.
about presence, about conduct, social media. These are not things we grew up with. We grew up in a very different environment, with a different set of values. So how do we respect the values of the new generation while still ensuring that we're carrying over these professional expectations and helping them see the difference? If you put too much pressure on a new generation, they'll be quick to tell you you're not authentic. Like you're not authentic. So there's this authenticity versus professionalism conversation that some of us struggle with too. So I mean, what are your thoughts about that?
And I guess, also you're a dean too. So you're coming from that, the young folks, you're constantly exposed to them. So I think that, that question is so relevant because we cannot function with old mindsets when we're dealing with new folks, when we're dealing with new school, right? Some of the old school things still, of course, they matter. They will always matter, right? They've never changed. Um, but we kind of have to find a way to integrate with their present reality without losing the soul of the soul of the matter, right? And so I was talking to my cousin the other day. She's a critical care nurse practitioner, and they recently hired a young nurse. She might have been like 20 or 21 or something. And this nurse and her are talking, and she's explaining to the nurse what she needs to do and this thing. And the nurse goes, "It's given a lot of work." And she was like, "What?" She couldn't believe her ears. She was like, "What did you say?" Or they said, "Okay, we're going to go and we're going to run a code." And one other nurse was like, "Clock it." And I was like, "Oh my gosh, what is going on?" And this is in a professional setting. So I see those things and it really makes me laugh and chuckle. But on the other hand, she'll say things like, the young nurse was told to do something. I forgot what it was. And then the nurse goes, no, she said, "No, you can't talk to me like that." So in a way, they're kind of speaking up for themselves, which is what we want. The way you do it matters, of course. So we want that aspect of their individuality, right? This new school where they can speak up for themselves, they're bold, they're confident, they know their boundaries and they set them. But then there's this other side where we're kind of found in the mix. So how do we kind of blend the two? For me, I would say there's no way to kind of get rid of who they are and what they are. This is the reality that we're faced with. But we can teach them in their own way. They can understand with their own voice, with their own tone, right? We can't force it upon them. Sometimes it takes experience for them to understand the things that we're teaching. And there's no other way to sort of drum it in until they go in and they kind of experience that maybe there's a system that they're working with that's just not going to be sustainable. Um, and so that's one example that I thought was pretty funny and relevant. But what do you say to a nurse who thinks it's okay to say, oh, it's given? Again, it's educating them, right? That these are certain things that in a professional setting you do and you don't do, right? I'm sure in our day there were things that we may have thought were professional or okay, but we're really not. And we had to be taught, we had to be mentored, we had to be shown. And a lot of things come with maturity and it comes with time. So it's just the consistent. And of course, you have protocols in place that cannot be breached because they exist within a framework, right? So it doesn't matter if they're Gen Z or Gen W, they have to abide by those laws and by those rules. So again, it can come from the top where there are rules, where there are policies that are being made that limit certain unprofessional behavior, correct? And so you can say, okay, we can't wear Crocs to work, and that's just a rule. So even if they like Crocs and it's a individuality thing, there is a rule that says you can't do it, and now you can't do it. Like there's just nothing. Oh, you can't use slang words like clock it at work, and now you can't do it. Like that's just how it is, right? So you educate, but you also put systems in place where you have to take certain privileges away without infringing on their own individuality, right? What they do in their individual, how they speak and all of that. Yeah, they can, but we have to make sure that we're training them, we're teaching them, we're educating them on their level, not on our level. And we're just being patient as they learn because it's a learning process.
Thank you so much, Nello. Does anyone have another question? Okay. Let me put this one there too, for the professionalism one, which I really love when we're talking about it, especially belonging to professional organization, to be able to know what is going on and get more knowledge and train ourselves as we proceed in our career. But one thing that was really, I believe Dr. Moore mentioned it over there about the cost of this, which is kind of pulling people away. But I know there are a lot of avenues that people can belong to these organizations at reduced cost or at times free, especially if they are in school. I don't know if you can a little bit shed more light on that for us, for our
Yeah,
audience, especially from the land area
yeah.
where we have clinics at socioeconomic status of the
Mm-hmm.
country. Also, they
Mm-hmm.
can have some discounted membership in some of them.
Yeah, absolutely. Thank you for sharing that. And I think you covered, half of that information for me already. But again, when you are interested, for instance, but socioeconomically speaking, you're at a disadvantage because of the high cost, you can be proactive, reach out to those bodies. A lot of people offer very discounted rates um, for what do you say, the students, right? Especially students, you'll find out that their dues are very, very reduced. Especially when I was a student, I was able to afford, and I barely worked, but I was able to afford my membership dues for the NSNA because it was very much discounted. And I can bet you, especially for American organizations, that you reach out, they have scholarships, they have people who are even willing to fund for others, right? So alumni members of that organization that have put out some money to fund for people who are not able to do. They don't really announce it. It's not made public. Otherwise, everybody would say, oh, they can't afford it. But you have to find those things, right? So you reach out to the member of, say, for instance, AACN or ANA or something and say, hey, I truly want to join this organization. I want to join my local chapter in my state. However, funding is a sensitive issue for me now. Do you have any grants, scholarships, blah, blah, blah? And they will reach out to you and say, okay, here's a 15% discount, or here's a payment plan that we can put you on, or something of that sort. And so that's a conversation that if you're willing to put yourself out there, you'll be surprised the results that you get back. But for one, I know that grants are offered, scholarships are offered, because there are donors and sponsors that partner with these organizations, and it is for reasons such as this.
Thank you so much. And for the sake of our time, we appreciate you. And I'm going to give it up and send it back to Prof.
Thank you.
Nello, thank you very much for your presentation. We really appreciate it. Just reminding us about professionalism, the art and the science of it all. Thank you for taking the time, for putting the presentation together, for sharing examples, and for making this truly participatory. I also want to thank, I'm looking in the audience for everyone who took the time to be here. A special shout out to members of our advisory board. As you know, Health for Nigeria is a nonprofit organization. We don't make any money, but we have 12 clinics in Nigeria that takes care of children, teachers, staff, and the local communities in which they are involved. And so we're in 6 different states, and we've had our advisory board or the board of advisors for the last 6 years, and they've done this for free. So I'm incredibly grateful for them. They always attend our presentations. I also see a lot of our friends and colleagues. I'm sure a lot of your friends and colleagues are here. So thank you very much. From now on, we'll send you the invitation so you can post it on your platform also. A lot of individuals are here from Federal Government College Idoani. I see my former alumni folks. Thank you very much for being here to support us. And once we're ready for the next quarterly lecture series, we'll share the information. Nello, if folks want to reach out to you, can you please share your information? I don't know if you want to share your LinkedIn or an email or something
Yeah.
in case folks have questions that come up later. We'd love for them to be able to connect with you.
Absolutely. I will share my LinkedIn on the chat, so you'll have access directly to my LinkedIn, and please feel free to reach out to me, and I'll be sharing that shortly.
All right. And for everyone who has attended, once again, thank you very much. We appreciate it, and we'll see you next time. Thank you.
Okay, bye-bye.